Hi, Dr. Terri DeNeui here, nurse practitioner and founder of Evexias Medical Centers. I'm getting ready to do a video series based on what I've learned over the last 3 weeks researching this novel coronavirus and some things that you could do to help boost your immune system, dispelling some myths out there about hand washing and things like that. But I just want to say, please do not take this as medical advice. I'm sharing what I've learned, but it is very important that you take information back to your trusted healthcare provider and create a plan for your health. Thanks. Hey everybody, Terri DeNeui here again. So in this video, I'm going to really quickly talk about gloves, masks, and hand washing. Because our medical clinics are open and we're seeing patients, of course, we've really spread out our patients and only having, one person at a time in the clinic and following all the CDC guidelines around infection control and making sure nobody has a fever and all of those things, and that's all very, very important. But I want to explain how this virus is spread. It is a heavy droplet spread. In other words, it's not airborne, but it's spread when you cough on your hand, you go open a cabinet, and then someone else comes behind and opens that cabinet and then touches their face. Remember, this virus has to get into the lungs to replicate and make you sick. So a lot of people have this false sense of security around wearing gloves, because if you're wearing gloves around and you're just touching things and then you go touch your face, scratch your nose, it's no different than having a bare hand. So really, glove wearing, you really just need to keep your hands away from your face. The other thing that is misinformation is around masks. Masks, like the general population has access to, these are really only intended for someone with a cough or symptoms to prevent it from spreading. This does not protect a person who is not sick from the virus. And the reason is when you put this on, we're wearing this and we're walking around thinking we're all protected, and I go open something, I get the virus on my hand, I don't wash my hand, and then I get up under here because this mask is making me itch and I start scratching. Again, it's hands off the face, hands off the mouth. That is how this thing gets in your lungs. So anybody that has a cough or cold or sneezing or runny nose or sniffles probably should wear one of these to protect others. But this is not going to protect me from someone who is sick necessarily. What will protect me, besides some of the things I'm going to talk about in subsequent videos and how we can keep our immune system, is constant hand washing, and really good hand washing. So I'm going to wash my hands and I'm going to show you how hand washing should happen, and then I'm going to have my camera person time me, because 20 seconds is a really long time. 20 seconds of good hand washing, making suds, making soap bubbles, getting in between your fingers, scrubbing your hands all in between everything for 20 whole seconds. I think, there's probably some songs, some choruses you can probably sing with that, but 20 seconds is a long time. Now, what happens is these soap bubbles actually break down the outside of the virus that has those spike proteins and those furin cleavage sites that actually get in the lung tissue. And so soap is really an amazing thing to kill a virus that could be on your hands. So while you're out and about going to the grocery store and all of that, yeah, you can wear gloves and that's great, but just be sure and take them off before you go touch your car handle door, right? Throw them out on the way out of the grocery store, or after you get everything off of your buggy and so forth, because again, it's just really challenging to not spread. Now, where are we at on the timing? Are we at 20 seconds yet? We're just now at 20 seconds. So look at all the bubbles. This is what you want. For 20 seconds, you want to get in between your fingers, etc., etc. Rinsing and just continual hand washing. I worked in the emergency room as a nurse practitioner during the H1N1 epidemic, and I diagnosed, looking back at my records, over 200 cases of swine flu, and I never got sick. I didn't wear masks in the room. You know, of course, when I took care of patients, I wore gloves, but what I did do is I washed my hands continually, and I took very high doses of vitamin D and vitamin C, and that's what we're going to talk about next.